Atherosclerosis is a chronic and progressive disease in which cholesterol accumulates in plaques within the arterial wall. This process is associated with inflammation, oxidative stress, and endothelial dysfunction. Left untreated, atherosclerosis greatly increases the risk of cardiovascular morbidity and mortality. The clinical events associated with this process typically involve sudden catastrophic reductions of blood flow. In the coronary arteries, plaque rupture and thrombosis can cause total occlusion.